So this is an introduction into the dental health service, and kind of been working on it for some time. And this came up recently, as I'm sure you're all aware. And I started in 1982, and I remember my boss at the time saying it's the end of NHS dentistry as we know it, because the maximum charge went over £10. And that was for everything. So it's a different world now, and we still get sort of bad press. But I think we can build our own dental health service. The other one's broken, as everybody knows, but no government will admit it. So I've made a website, and I'm using something called WordPress now, so I'm gradually learning as I go along. And nearly everything that I've learned since I've stopped work is outside of dentistry. And this was really interesting. I heard this a few years ago, and she advocates something that we should all do, because it's kind of like the war on sugar. And I listened to this 2 days ago. I read a book, and that was interesting, so we'll come to that at the end. But basically what we should be doing is we should be all kind of working as health advocates, because we don't really need to know everything in order to, but we can still pass it on. So that's the idea. So I've made this website when my dad got ill, and so you can look at that. That's made on something called Weebly. This is also made on Weebly, and if you want 3 hours of seeing why I've done it, it's on my dental history there. And I started making YouTube videos. The first one I made was when I was working for a corporate and I wasn't happy. And that was, I nearly got, what was it called? Constructive dismissal for that video, my first video, which actually I've deleted. So you can't find that one, but there are lots of videos there. Yeah, and please subscribe, right? If you subscribe, more of the public will find, hopefully useful advice. I made this a couple of years ago, and that will be within the website. It's how anyone can make money through dental scanning. And when I say anyone, actually it is anyone. The scanning and scanning. And I made this around the time of COVID, because I thought that lots of young dentists weren't coming out with the experience. So there are lots of things on there, one of which it does introduce a different app. I made an app called Teeth for Life, about 8 years ago, which was on the other one. And also on this, it's really just a website for a library of videos, and I put the text for the videos. So no one's going to listen to me, but your patients will listen to you. So there's instructions on how you can make your own videos there. And the other thing at the background is about Agile, is how you can develop something iteratively. And it's how how IT develops, and all the AI people are doing this, as you know, fighting one another. Unfortunately, I haven't got their money. And so this is my office, and that's, you can see some dentures there and a printer. Was fiddling around working out how we can make 3D printed dentures, and that's definitely viable now. And these are some of the books that I've read, and I think, as you can see, there's only a couple related to dentistry. But this one is really interesting. I mean, they're all interesting. The Faster Cures one, they're all interesting. And basically, on my website now, is if you open it up, and you'll see what's called a hero page, and it slides across. There are 3 main things that any trained dental nurse can do. So they can apply a varnish, and that's the one that's had 280 views. Teledentistry, that's only got a few views, but you could give oral hygiene instruction, and as you can see with that child, disclosing advice in the bathroom. And this one is on, again, about the 3D dentures. Well, at that time that had over 34,000 views, which is a lot for me. It's about 34,000 more than normal. But there's obviously something in that, and it's a way that people can actually go into a care home and earn money, but also deliver advice and help and support. So if you go onto the website and then you scroll down, you'll see this, which is an attempt to triage people for dental pain. And a bit further down, you'll see how we can use scans of the mouth and make all kinds of different devices, not just dentures. And these would just have the public can test themselves. And then further down again, it's got the reference to the care homes, but also something about, not necessarily ideal treatment, but treatment that's good enough. Because we need to be able to do something to help most people, not do what is sometimes regarded as the perfect thing. And this is an area where I think the public can share or at least save their x-ray scans and photos so they can get second opinions or even just AI opinions when they can't get anything else. We've got lots of people who can take x-rays, but there's no dentist in the room, so they should be able to do that. And yeah, further down then, I kind of developed this a little bit further, is how you can ask questions. So anyone can ask questions, but I wouldn't press on see all assistants there. I press on the little icon there that we've kind of called Aura, and what that is it's an assistant, so it should take you to this page here. And so when you look down, there's these assistants that I've made, but what's interesting, they're all on LLMs, so it's what's called we've got guardrails in, and so all the information within these is information that I've made as videos in the past, or delivering better oral health and the Scottish guidelines on dental pain. And I did have help from a university student to make a chatbot, but that didn't quite happen. It's not quite there. And this is how you would log in. So I'm making a video on that at the moment, and how you can be found. And what we want is, when you log in, then you should be able to find the resources, as you can see, and that's still within the website, but it's quite a lot in there. And so if you, it also talks about starting your own business, and that'll take you into the DentalHealthService.net, which is a website that is where we can all learn. And then ultimately, once you've registered, you should be able to be found, which is on a map. So there aren't that many of us about. Mainly it's just me. But the idea is now that the map's kind of working, is that you can promote yourself, and you can promote what you do, and you can charge from yourself. It's how we can actually start to go around care homes and maybe visit people in their own homes or maybe schools. But we've got to do stuff that's different. There's no point waiting for the government to do something. I think we can do it ourselves, and it's happening in other countries. So you can see there's Sarah Luke, who I've met a few times in Portland, and we can learn from one another, and that's the whole idea. And so to find the service, that's the maps. So get on the map, please. Add yourself to the website. And so I'm going to put this all on my YouTube channel, which is Teeth for Life. I'm not sure if we skipped through that. If you have a look, some of the ideas that I've had over the last 5 years, I've definitely tried for different types of funding, and you'll see this in a moment. So the next video is got a different audio. It's from Charles Koch, and I just added some videos on one of my applications for mouth cancer screening. I've also done one for a dental app. I did one for 3D printing. I did one for health hubs, and they're all there. So please have a look. Maybe you'll get more luck if you apply for funding, but you're really up against it when you apply for funding. So this is, I think this is Charles talking. I hope he doesn't fine me for this.
Most states have so-called Certificate of Need, CON, laws, which create government boards that determine whether medical facilities can expand, innovate, or even get off the ground. The boards are usually stacked with representatives of hospitals and other healthcare providers. That is, the potential competitors of the new or improved facilities. They have a clear incentive to deny CON applications, which happens all the time. The result, studies show CON laws can reduce the number of hospitals in a given area by 30%. And while CON laws are sold as a way to lower healthcare costs, they actually make healthcare more expensive. It's no wonder that these were among the first laws to be waived in some states when the COVID-19 crisis hit. They made it harder for patients to get the care they needed. It's a similar story with other restrictive policies. Federal rules prevent doctors from practicing across state lines, which limits access to care. An absurdity in the age of telemedicine that only survives because state medical associations lobby for it. Similarly, state scope of practice laws restrict the services that nurses, physician assistants, and pharmacists can provide. This restriction benefits doctors, but raises costs and limits access for those who can least afford it, which can lead to worse health outcomes.
So we're all there. I'm sure you can see the references to, clearly I feel that we should be using the hygienists, therapists and dental nurses more. And I can't see why, I've given some cameras to care homes already, that we can't actually expand different people's roles. To restrict them to the extent that we do now, I think is wrong. So anyway, there's some contact details. If you're interested in this, at least sign up and get yourself on the map, and get back to me. And if you want to give some further advice, because I'm sure that the assistants aren't perfect, but if you ask them a question and it doesn't give the correct answer, then send me the question and I'll be able to manipulate it so it'll learn as we go along, and when the public ask a question, then it should give the correct answer, or at least guide them to a correct answer.